Hello, my name is Lexi Orlando, and today we're going to be going over the internal palpation of the muscles of the TMJ joint, along with different manual therapies that these patients might benefit from. To start, we can locate two of the muscles externally. The first one being the temporalis, which begins in the temporal fossa and travels down to the mandibular ramus in the coordinate process. The next muscle we could palpate externally is the masseter, which begins at the zygomatic arch and travels down to the mandible. With this one, we could have the patient clench and we could feel that muscle popping into our fingers. Now we will dive a little bit deeper into the external manual therapies that we can do to help benefit these patients. The first one that we're going to be going over is the temporal release. There's two different versions of these, so we're going to begin with the first. So what we're going to do is we're going to kind of hook our fingers, find that zygomatic arch, and kind of hook it underneath where that temporal muscle inserts. Here we can apply that pressure a little bit upward or cephalically and inwards until that patient feels the release, or holding here for about 60 seconds. The next one that we can do for the temporal release is sticking our thumbs in the patient's ear canals, so kind of hooking into here. And what we can do is we can apply pressure inferiorly, distracting that temporal bone from the sphenoid bone. The patient may feel a rush of heat into the ears or almost feel like a rush of water. Once the patient feels that, we can go ahead and release this pressure or hold here for about 60 seconds. The next manual therapy that we're going to be going over in this position externally is the external TMJ distraction. Here we're going to find the condyles of the mandible, and from there you can use your fingers or your thumbs. I prefer to use my fingers. We're gonna distract caudally, holding there also for about 30 to 60 seconds. Following this, I want to go over the sphenoid release. So this manual therapy is done especially if a person is having headaches or dizziness. Some may even feel nausea or vomiting. And what we begin with is looking to see which eye is set further back for the patient. And that's usually the side that the individual is experiencing that sphenoid torsion. And so for Sam, I'm going to look from above. Her right eye seems to be kind of set back a little bit more, so we would do the sphenoid release on that side. So with this, I'm going to apply two fingers right over the sphenoid bone and thumb right in the surface of the ear canal. And what you'll do is you'll kind of pull until you feel that area of restriction at the ear. And once we find that spot of restriction, holding there for about 60 seconds, again with this one, the patient might feel that rush of warmth or almost feeling like that rush of water in their ear. The sphenoid release is always followed by a cranium release to allow that pressure to kind of escape through that jugular foramen. So what we're going to do is we're going to take two fingers, putting one on the occiput and one on the mastoid process of that same side of that sphenoid torsion. Our opposite hand is going to go on the opposite frontal bone. You want to apply gentle pressure downwards with that hand until you feel those two fingers slowly spreading apart. Once this is felt, you can go ahead and stop that treatment. Allow the patient a couple minutes before they sit up and allow them to slowly sit up due to dizziness that sometimes occurs after this manual therapy. Now we will go into the internal palpation of some of the TMJ muscles, including the medial pterygoid, the masseter, along with the lateral pterygoid. So with this, you want to have gloves on for your patient, and you want to palpate on the same side as you are sitting or standing. So from here, you would have the patient go ahead and open their mouth, and we will slide a pointer finger into the side of their cheekbone, making sure we're clearing their teeth, and then have them go ahead and close their mouth. In this position, my finger is horizontal, so kind of stroking along the tissue of the masseter. Go ahead and have your patient clench. Good, and you can feel that muscle popping right into your hand. With this, with the outer thumb, you could also palpate that muscle externally. However, it is easier to feel that muscle internally. Next, we can palpate the medial pterygoid muscle. The fibers to this muscle run a little bit more obliquely than that of the masseter. And this muscle is responsible for closing the mouth and protrusion, along with contralateral deviation, attaching from the maxilla tuberosity and then down into the internal angle of the ramus. From here, we can kind of stroke along those fibers of that muscle a little bit further back. From here, what we want to do in order to palpate the lateral pterygoid is we're going to kind of rotate our finger upwards towards their head, the top of their head. And what we're going to do is you'll come up and down vertically. Sometimes this can be uncomfortable for a patient that has TMJ dysfunction because this muscle is often the culprit. This muscle's function being opening and protrusion of the jaw along with contralateral deviation. This muscle also helps pull the disc forwards and the condyle forwards. Good. All right, and we're going to rotate back out, have the patient open their mouth. Something else we can do when we have the finger palpating that lateral pterygoid is we could also take our finger or our thumb and press down on the sphenoid to help bring that bone a little bit closer to the muscle, as the lateral pterygoid does have an insertion on the sphenoid and allow to kind of slack that muscle, make it a little bit more comfortable for the patient as we do a release. For joint mobilization of the TMJ joint, we also want to be palpating or mobilizing by sitting on the same side of the patient. The first one that we'll do is a caudal distraction. So you'd have the patient open their mouth. You're going to hook your thumb further back on their molars, and we're going to apply a downward force. The next mobilization we're going to introduce is an anterior glide, also in this position. You're going to keep that downward distraction or that caudal distraction, and we're going to pull the jaw forwards. And we can also do a posterior glide in this position by pushing the jaw backwards while maintaining that distraction. Another glide that we can do is a lateral glide. And with this, you're going to take your thumb and hook it underneath the front teeth. And from there, we can glide laterally. Gentle motion. The next mobilization that we can do is to help relocate that TMJ disc. So this one, we're going to use both thumbs, having the patient open their mouth and hooking the thumbs bilaterally towards the molars. And here we can perform a circular motion, so having the patient relax as much as possible. And then with this, we can help relocate that disc by circling up and around, closing and retruding the jaw. Thank you all so much for watching. I hope this video is helpful in terms of TMJ manual therapy and internal palpation. And thank you to my lovely patient Sam for assisting me with this video. Have a good one, guys.